Oh, I think we are live already.
All right, great.
Okay. Yep. All right. Good afternoon. So, as I promised, I was going to be back in 15 minutes and I'm back. So, this is American Surgery Center. My name is Kemal Erkan. Today is July 23rd, and our Bariatric Friday event with Dr. Irgau. As we promised, we have new topics. We have a group of topics that we are rotating, dating. So this today is another one of those. So, but first I'm going to ask Dr. Irgau to introduce himself, and then we'll start from there.
Thank you, Kemal. Thank you very much. Hello, everybody. Welcome to Bariatric Friday. My name is Dr. Irgau. I am the president and co-founder of CHRIAS, or Christiana Institute of Advanced Surgery. My specialty is weight loss surgery or bariatric surgery, and I have been performing bariatric surgery now for about 20 years. Together with my associates at CHRIAS, we are by far the most experienced group when it comes to bariatric surgery in our area. Thank you, Kemal.
Thank you, Dr. Ergau. And just so that we introduce all of our other surgeons in our team. Dr. Irgau already introduced himself, and then we have Dr. Gail Wynn, Dr. Mike Peters, Dr. Rahul Singh, and Dr. George Ibrahim on the bariatric team. And then we have Dr. Sachin Vaid on the colorectal side. And we have 3 dietitians who are working with our bariatric patients with morbid obesity, Fran, Amy, and Beth. They are part of the team, and they support our patients from the beginning to the end. And even after the surgery, they are part of our program for our patients. Now, our program, as we mentioned so many times, is one of its kind where, as a surgery center, we were able to achieve FASMBS AQIP accreditation, as well as Blue Distinction Center Plus, Aetna IOQ certification, and these are all happening in a very short amount of time. The reason for that is because, as Dr. Irgau mentioned correctly, the expertise that we have from the surgical side is the key for us, and then that's what we do. That's what we have, and that made it possible for us to be able to get to this point. Now, the idea of doing this event, and then I'm just going to share this very quickly with the group that we have, so then they don't yell at me later on. If I can have a second. Okay, so this is 1, and this is 2. Okay, now we are in the 3rd round of the same topics, right? So the reason we are doing this, there are certain elements of bariatric surgery that makes it extremely important for us to prep the patient. And also during the surgery and after the surgery, what the patient needs to go through. So having one of our surgeons, Dr. Irgau, with us and explaining each topic, and we want to have these in a smaller conversations, so that way, while you are going through the process, if you are actually in the surgery center right now, or if you are in the CHRIAS office or one of our outpatient practices, we play these in our waiting rooms. So you may be watching these, or you can actually, even if you don't have morbid obesity, there's still things that you can learn, because this is not just obesity, but it's the metabolic issues that we all have day to day, we all deal. So today we are going to talk about smoking and alcohol use before and after surgery. Dr. Irgau, when we do the case conferences, especially smoking comes up. It comes up in 2 different ways. One is from our office policy standpoint. The other one is from the insurance policy standpoint. And some insurances are more strict than the others. So from the clinical side, if you can separate the smoking and the alcohol into different ways, what are the risk factors for the patients for the smoking before surgery and after surgery, and why we want, well, we don't want anyone to smoke, but why it's more important for the patients with the surgery potentially?
Absolutely, Kemal. This is a very important issue. Clearly, we know now, and we've known now for many, many years, that smoking and health do not go together, right? That is clear. So by definition, anybody who is smoking also is putting their health at risk. There is no question about that. It's a very well-established fact. But then as surgeons, we know that there are particularly important reasons why we want smokers to refrain from smoking before surgery. This is in surgery in general. We know that there are effects on the healing of the tissue, so interference of the tobacco and the nicotine with the healing process, increasing the potential for complications is one issue. The other issue also clearly is the ability to tolerate anesthesia, particularly general anesthesia for somebody who is a heavy smoker, decreases, and then the risks for what are called post-surgery complications in the pulmonary system, in their ability to breathe freely, in their ability to be free from something like pneumonia. All those things actually decrease if smoking is in place. So there are clear reasons why surgeons don't want their patients to be smokers, right? But then there are additional reasons why we want smoking to stop before bariatric surgery. And those have to do not only with the risks associated with the actual immediate surgery, but also with the post-surgery situation, particularly in procedures like gastric bypass, for instance, Kemal, where we are making an artificial connection between the stomach and the intestine, and that connection, we call it anastomosis. That connection is particularly vulnerable to formation of something really serious called ulcers, right? Ulcers are almost like wounds that can occur at that connection, and those ulcers, not only they are so painful that they can make the person's life really miserable, they can also have complications. They can burst and perforate, putting the person's life at risk. They can cause severe life-threatening bleeding, right? And those ulcers may be extremely difficult to treat if smoking is present. So we really, really put a lot of emphasis on the issue of cessation of smoking before bariatric surgery. There's no question about that. Now, that conversation, Kemal, as you know, starts the first day when we have the consultation, right? If we do see a history of smoking, then we counsel patients. And I'm very upfront with patients. I tell them, look, they are your biggest challenge as you prepare for bariatric surgery is going to be smoking cessation. And if you think you're not going to be able to stop smoking, you probably have to rethink about the bariatric surgery issue and maybe come back at another time when you think you're ready to stop smoking. It is that serious. It is that important. Now, what is the time period that we want our patients to be free from smoking, Kemal, before surgery? Well, the earlier the better, of course, but we want at least 4 weeks before surgery for them to be completely free from smoking. So that's why smoking is important. So we are undertaking an elective procedure to treat morbid obesity, to get them to become free from metabolic diseases, but we don't want them to go through that surgery and endanger themselves if they are still smoking. So smoking cessation is extremely important when it comes to bariatric surgery.
So, Dr. Irgau, and I understand the risk of the smoking and our policy. So, just recently, one of the federal federal employers is requiring 6 months no smoking. So, when our patients are going through this process, well, we are not promoting smoking at all, but going through this process is already difficult, adding so many hurdles on it. And quit smoking is another big battle. If I'm thinking, just since we have our webinars, patients can actually just go to those webinars and watch them on Tuesday at 6 p.m. every day, second and fourth. So I just want to take this conversation out of that traditional teaching setting and then just play the devil's advocate a little bit.
Mm-hmm.
So if right now I'm 210 pounds, with a little bit lie, maybe 212. So actually, no, I'm doing good these days, thanks to my nephew. He's every morning.
I know you are.
2.5 miles in the morning. Now, our patients, if they're my height, they're about 350 pounds, 370 pounds. I'm 6'1", right? If I have a 370 pounds patient, what I'm sometimes, as non-clinician, what I'm not able to understand is, now I'm gonna get a surgery, so I have to be qualifying for this. I have to do so many different things. Now, and you said our policy is 6 weeks or 8 weeks?
For cessation of smoking? Actually, 4 weeks. 4 weeks is
4 weeks.
4 weeks.
4 weeks, no smoking.
Yeah.
So, and then there's this insurance company is requiring 6 months.
Mm-hmm.
How is this helping if I'm 370 pounds, if I cannot quit smoking, or if I'm not able to get to that, because I need some changes in my life, right? So some motivation, some positive impact. So like, because if I see the impact of weight loss, I may be more motivated to quit smoking faster. Like that risk exchange, like waiving that risk, I'm sometimes struggling with that. If I was a patient in struggling with this, what would be happening to me, because I couldn't do the 6 months free, I couldn't get to the surgery? What's more riskier for a patient?
Absolutely. I mean, that is an extremely important point, Kemal, right? Because remember, as you correctly said, the greatest danger for many of our patients, of course, is the weight itself, right? Mm-hmm. And we talk about the fact that I personally have had patients who have died from a heart attack waiting for bariatric surgery whilst they were going through the process, right? And that is tragic. That is tragic. So we have to do everything we can to prepare our patients well, but we shouldn't put unnecessary delays and hurdles in front of our patients that not only put them in real danger, but also potentially take their motivation away from seeking this treatment. It is hard enough for a person to actually come to terms with the fact that their disease requires surgery for its treatment. That's not an easy decision to come to terms with, right? In fact, if you ask most patients, the first time they hear bariatric surgery as a solution for their weight, they reject that idea right out. They say, no, that's not for me. I can do it myself. Mm-hmm. There is this illusion that they can do it, right? They have been making a New Year's resolution year after year, and they keep repeating that resolution precisely because it never works, right? So when they hear about bariatric surgery, they still think that that's not something. That's almost like a cop-out, because there are so many biases that are really put through by society. People think that it's a weakness to go to bariatric surgery, right? They don't understand that it is a very important form of treatment, right? So they reject the idea when they first hear about it. And on average, it takes about 2 years for someone to come to terms that bariatric surgery is an important solution for them. And right when they've made that decision, for someone to come and put hurdles on their way makes no sense. There is absolutely no data to support that stopping smoking for 6 months is any better than stopping smoking for a few weeks before surgery. There is no data to support that. And yet, this is one of the hurdles we see from many insurers, Kemal, that are really, really designed to deter people from seeking important treatment, right? I mean, an insurance that is tasked with safeguarding health should not be putting obstacles in front of people when they are seeking help, right? So 6 months to me does not make any sense at all, right? Of course, as you correctly said, we are not saying that stopping early is a bad idea. Absolutely not. The earlier they stop, the better. But we have to be realistic, right, in what we do. To say to somebody, yes, you want to have bariatric surgery, because once patients really realize it's an important treatment, they want that treatment immediately. They can't wait because now they see a solution, they see a way out. And when you see a way out for a problem that has really cursed all your life, Kemal, you want it now. You want it as soon as possible. And when somebody tells you, you have to wait in line for 6 months for reasons that I have decided to impose, it makes no sense at all. It makes no sense.
So, Dr. Rahul, with the smoking, we are going to talk about the alcohol use. The smoking is pretty, I mean, it's a lot different than the alcohol, because alcohol has its own issues. But smoking is, the 6 months, like we are saying that we are very strict with the 4 weeks, right? But if you require 6 months with one insurance, again, well, it's Blue Cross, federal employer, federal Blue Cross is one requiring 6 months. Today, one of the patients, we have to push the surgery date by 5 months. Now, all I'm thinking is, what about the morbid obesity? So you are penalizing this patient, and I'm just so sick of hearing this, let's just penalize them, punitive, just another, just hit them one more time. This has to change. Now, here's what I'm trying to say, because I start thinking those evil people now, Dr. Irgau. So I'm thinking, so they're hearing, they don't care about smoking. No, we do. So what we are saying is, and what I'm saying is, and Dr. Irgau's validating what I'm saying, if we are able to get our patients starting the program, we have 3, 4, 5, 6 months to work with them before the surgery. So if you cut the patient off from the beginning for 6 months, they will never start the program. When they start with us and knowing that they have to stop smoking, I have time to work with that patient.
Yes.
Okay. But when you say 6 months before the surgery, there is no clinical data supporting that, as Dr. Irgau correctly said. But also, there's no support for the patient.
Yes.
This punitive approach in medicine is like a bad culture. I don't know, some insurances, maybe some medical directors, they don't have to retire, and maybe then we'll have new policies, because these are old policies. Now, again, no one is saying that patients should be smoking or we should allow the patient smoking, but let them start the program, get them in, let us work with them, let us support them. These patients do need more support than anyone else. We work with them every day. But when you prevent us to work with them from the beginning, then who's actually benefiting from that? No one. So,
Absolutely. So Kemal, in fact, I may know the patient you're talking about, right? It's interesting because that patient came to see us first in early April, I believe, right? And smoking cessation was the very first thing we talked about, right? We have protocols, we have educational materials, we have facilitating processes that we utilize to help people quit smoking, because we know quitting smoking is not easy. If it was easy, a lot of people would have, right? A lot of people want to quit, but it's very hard. It's one of the things which is very hard, right? Now we help them through the process. And that patient actually quit smoking in May, right? In May, that patient would have been ready according to our protocols, right? Because now we are in end of July. So she has been off smoking now for almost 3 months, right? Great, kudos, right? And yet, this insurance policy is now requesting that patient to wait another 3 months, right, before they can have surgery. That patient has been so successful. Now, that patient, actually, I do remember talking to them. They were very frustrated because they thought we were imposing this arbitrarily, this kind of thing, right? And we had to do a lot of explanation to let them know that it's the insurance policy. And yet, if you have somebody that becomes so frustrated, they will be very close to giving up. First of all, start smoking again, because they're putting so much pressure on them that they could go back to old habits of smoking because they're stressed, right? Secondly, the chance of them quitting the program increased tremendously. And that would be a shame. So I understand what you're saying clearly, Kemal. There are legitimate things that we healthcare providers understand are better placed really to work with patients, and yet insurance companies implement policies that really are not helpful when it comes to taking care of our patients.
Absolutely. Now, Dr. Gao, our other issue with this topic that is alcohol use. Well, alcohol is very different than the smoking situation. So if you can kind of educate us on the alcohol and what our patients should and should not be doing, how much they can drink, should they drink, and all that.
Absolutely, Kemal. So first of all, it is clear that alcohol by itself can increase caloric intake and can interfere with weight loss attempt, right? And the reason for that is, first of all, alcohol itself has calories, right? Lots of calories if one drinks a lot. And secondly, it is actually something that they can increase the appetite of a person. The more alcohol a person drinks, the more likely they are to eat. So from that point of view, really limiting alcohol intake is extremely important from a weight loss process point of view. This we understand very clearly, right? But then there are other issues related to bariatric surgery, and that is the amount of alcohol that can cause damage, real damage to a person is much, much smaller after they've had bariatric surgery. This is very important for people to understand. So particularly if they have something like gastric bypass, Kemal, because the buffering function of the large stomach is not there any longer, the alcohol enters the small intestine and right into the liver immediately. So they can cause liver damage much more readily with much smaller amount of alcohol than they realize. So this education is very important, and we provide that. So we're not saying you can never have alcohol at all, but we say be absolutely, absolutely careful on how much you consume. Certainly, we discourage highly daily consumption of alcohol after bariatric surgery. From time to time, can they have alcohol? Yes. Are there some alcohol drinks that are better suited for them? Yes. For instance, I think wine, particularly red wine, is okay, and red wine may have even some beneficial effects when it's consumed in moderation. Now, we discourage alcoholic beverages that are sparkling, like beer, because sparkling or drinks that have gas in them, they are not very good after bariatric surgery, so we discourage them. And also spirits and liquors, those also we discourage highly, just because the alcohol content with smaller amounts tends to be so high. It's very difficult to drink those in moderation. So alcohol is an important issue that we confront with our patients and we talk about. Besides that, Kemal, there are another category of people that we really, really are very, very concerned about when it comes to alcohol, and that is patients who have had issues with alcoholism in the past, right? Even patients who have really overcome alcoholism and they have been sober for a long period of time, we really encourage them to absolutely refrain from going to alcohol. And the reason for that is once they get back into drinking alcohol, they can relapse. And relapsing after bariatric surgery is an absolute disaster because the chances of damaging the liver are much, much higher in that instance. So clearly, in general, we say alcohol in moderation is okay. And when we say moderation in bariatric surgery, we talk about 50%, 40%, 30% of what moderation would be in a normal situation. And then for people who have had serious problems with alcohol in the past, then we tell them complete abstinence is by far the best policy. It's all about education, Kemal, and we are very upfront in our educational endeavors at the beginning.
Now, with the alcohol, Dr. Gao, I think in terms of how our body actually works, especially certain organs, and liver is one of them, and I think the pressure on the liver is more. Can you explain that a little bit?
Absolutely, absolutely. So the alcohol is metabolized by the liver, right? So the liver is an extremely important organ when it comes to breaking down different substances into smaller components, and that's what happens in the liver. But there is a load. A load, it means an amount that the liver can tolerate, right? Beyond that, it becomes too much. And over consumption of alcohol can actually lead to slow damage of liver cells. Now, because the liver is a large organ that has a very large amount of redundancy in terms of its ability to compensate, you can get liver damage to a high percentage and still have good function of the liver because it takes over. But then when you lose that reservoir, when you lose that redundancy, then you have liver damage and there is no way out from there, Kemal. Then you're looking at transplant essentially, right? So that damage can occur much more readily after bariatric surgery, as I said, because the alcohol migrates into the liver much more quickly when the digestive tract has been altered with bariatric surgery, particularly in terms of gastric bypass. So for instance, if a person has a normal anatomy, they have not had bariatric surgery, the alcohol would go into the stomach and the stomach will empty its contents very slowly. And even if there is alcohol there, that content will be slowly emptied, right? And it slowly will go to the intestine. And then from the intestine, all the absorbed substance have to go to the liver first, and the alcohol will be the same, right? But that process is accelerated, obviously, if there is no stomach reservoir, if there has been bariatric surgery. So damage to the liver can be much higher. Besides, if the alcohol enters the system much more rapidly after bariatric surgery, the ability for a person to become drunk with alcohol is much, much quicker, right? Even a smaller amount could get them drunk. And then remember the consequences of that. If a person is not really in full control of their senses, then the chances are that they could cause damage to themselves or to others much more readily. So we have to make sure our patients understand this and understand it very clearly.
And that's really important, so that unless we know exactly what it is, the implications and the consequences are, then if they don't know, if they think that it's going to be just like the way it was before, it's different. In this case, it's much different, so that we want to make sure that patients are well educated while they're getting ready and after the surgery and before the surgery. And we are providing all these in our visits when the patient comes to see you guys. And we are also providing these videos now. They are readily available for our patients, but it's never enough. That we have to do more, and we'll do more. There is no problem with that. Now, I do want to actually share a couple other things, Dr. Irgau, and then from our patient survey standpoint for American Surgery Center, it's it's an exceptional patient satisfaction ratio at 99.4%. This is not a norm for any of the surgery centers or facilities. Hospitals are running around like 70%. This is an amazing number for us, and we thank our staff, our nurses, our patients, our providers to make this happen. And our patients are going, like these are, I try to put new survey updates for you guys every week. So these are new surveys. Our patients are going way beyond what normal yes, no questions on the survey, and then they write really good messages for us. And I personally go through them, each one of these one by one. And one of our projects is to bring our patients to one of these sessions, hopefully, once they receive the letters and they respond to them. So I'm hoping that we can get a couple of patients joining us in these live sessions. Make sure that you activate your IQ Health patient portal. And I know many patients they're getting their survey directly from the IQ Health. You'll probably see my name on those as they're automatically generated from the system. Our events are pretty much set now. Our Bariatric Friday, every Friday at 1 p.m. Our weight loss, if you want to actually kind of get into this a little bit deeper and more on the technical, clinical side of it, you can come to the weight loss seminars every second and fourth Tuesday, 6 p.m. My Friday updates from United Medical ACO is 12 noon, and Wednesday wellness webinar is second and fourth Wednesday every month. So that's pretty much what we have from here. Now,
before I forgot, Kemal, I have to mention one patient that I was talking to who really watched some of these videos that we've done was asking me if it's possible for them to suggest a topic for Bariatric Friday and where can they suggest that topic. So I guess they can put it in the comment.
Yes, absolutely. Or they can email me.
They can email you, absolutely. Okay, perfect. I'll let them know.
They can put a comment or they can email me. It's on the channel. That would be great if we want more participation from our patients. I sent about I think 85 letters to the patients. We picked from the group of patients who already who were satisfied from the services. We picked a group of patients who had the surgeries in certain date range, so it kind of limit the total number. So, but if there are any patients who wants to come and share their experience, we would be more than happy to have them. It would be great to have them in this session, so hopefully that will happen. Dr. Irgau, thank you again for joining me, and we'll be back next Friday. And until then, please stay safe.